Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I've got another interview with Dr. Chris Chippendale from the UK. We are diving into more patient experience stuff. He's kind of our resident patient communications expert, does a great job of that. I had him on last year. We've had him on before. We had him do a webinar for our mastermind group, which was awesome. A lot of great feedback on that. And so him and I are actually going to be teaming up June 20th of this year, 2026 in London. I'm going to be in the UK for 6 weeks with my family. And we decided to do a one-day masterclass on the patient experience. And that'll be half done by Chris and half done by myself. He's going to really tackle the doctor communication side of it and the trainings he does. And then the second half will be me talking about the patient experience, certain things like service versus hospitality, but really helping you design a great patient experience, one that is going to be remarkable. In between what Chris talks about and what I do, you're going to leave there with a workbook of a new patient experience. So you're going to leave with a new patient experience, and we'd love to have you there. If you're in the U.S., you can go have a vacation, but we do actually have a pretty good audience of Europe-based listeners. So if you're there, we'd love to have you. You can check out bit.ly/MCMUK26. That's the number 26. So bit.ly/MCMUK26. And so our conversation that Chris and I have today is centered around how important patient communication is going to be in the age of AI and how it will, not hinder people, but maybe impact people if they're not careful, how AI can help you enhance your communication, avoid AI slop and things of that nature. But it's a little wide-ranging conversation around the patient experience. Without further ado, here's my interview with Chris Chippendale. All right. Excited to have Chris Chippendale back on our podcast. We have him on pretty frequent here because I like to revisit with certain guests where I think that the topic is very, very expansive and can continue to evolve and also is timeless. I think that's a unique thing with certain topics. And then also just the wisdom that he brings to our podcast around this topic of patient communication, which would be a subtopic of overall patient experience. So Chris, what's new in your world?
Hey, Kevin. Yeah, good to chat again. We've just been looking at a couple of changes in the clinic recently. So our sister clinic, we've got somebody going on maternity leave soon. So we've been looking at getting a couple of people in there to help cover and really just kind of building up a team that we have there. So I've been doing quite a bit of training with them around patient experience. We had a group, we got both clinics together for an afternoon, for a training afternoon recently. And this was the entire focus was right. What are we doing well? And I will say, I'm very proud of my team. They do an excellent job. Looking at the things we're doing well, but then looking at the things that we could just take up to that next level. I'm sure we're going to get into it, but I actually believe that this year and the next couple of years, that patient experience is going to become even more important. And I think it's going to become an even bigger differentiator for clinics. And we've got more clinics in our area now. There's more competition around there. And I'm confident with where we're at, but I'm always looking to make sure we don't just get comfortable and rest on our laurels. Make sure we're still up in our game where I can, and just giving patients the best service you can.
Yeah, you use the word even, like even better and even more important. I've learned to use that word a lot more. It's a really good word. One of my first podcasts 9 years ago with Joel Weldon, he's a Hall of Fame public speaker. And in that episode, he talked about the importance of the word even, and he used it as reference of your patient might want to get better, but they're already doing really well. We can get you even better, right? And he talked about that in different things is where that word helps, because if you went to your team and said, look, we got to get better at patient communication, or we got to get better at this, they automatically will say, whoa, we must be doing a shitty job. when you use "we got to get even better" just means, look, we're doing great, we're good, but we can get even better, right? I love the nuances of words.
Yeah, it's that little hint of that growth mindset, isn't it? Yeah.
It is, exactly, and that's where I think it's cool that you're continuing with that with your team, and I know that's something that you and I are going to be in London June 20th around the patient experience, and you're going to be doing half of it, and I'm going to be doing half of it, and it's one of those things where those that are attending or will be attending is we're not saying you have a bad patient experience. We're just trying to get your patient experience even better, and I think today's day and age with what we're going to kind of talk a little bit about today as a backdrop of AI. This isn't going to be an AI episode and using AI for the patient experience per se, but there are going to be some things where AI does help. But I think there's going to be a lot of situations where people are going to be yearning and looking for a little bit more human connection and having really good communication around it. So what are some of your just initial thoughts before we dialogue this out on, where AI is going to put us in the patient experience and what that's going to mean for the humans we still have in our practice?
I mean, I've been keeping an eye on the AI stuff for a while. Like, a couple of years ago, I started diving into it and seeing what it was about. I remember making a prediction 18 months ago, and this was more to do with the coaching space, that I said, look, looking at what this is going to be able to do now, it's just about to do lifelike photos then. I remember very time my parents saying, you're going to see an absolute flood of very amateur coaches using AI to make them look like they're experts.
Yes.
And it's going to get harder and harder to tell who's the genuine expert here and who's using AI to look really good when they don't know you do that. And lo and behold, I'm sure you're seeing the same now. Loads of just very generic AI content being put out there. But our patients are seeing the same thing as well. I think that it's already changing how we can, a lot of us now have this experience of reading an email and going, I don't think you wrote this email. I think you used ChatGPT.
Okay.
And there's elements of that are good. I think it's not something that I'd turn my nose up at. I think you can use it to really help come up with great ideas. I think using it in communication to sort of go, I'm trying to say this thing. How do I get this idea across that I don't want to be misunderstood? I think it could be really good for that as well. And I know there's quite a lot of chiropractors who use it for like the encrypting social media posts, getting a copy on their website, nurture emails, newsletters. I think it can be good for that kind of thing, but I think what it's doing is it's basically becoming the new standard. And you are seeing online some groups of people really rebelling against that. I mean, I didn't realize how anti-AI some people would be when this started, but I almost notice it myself when I see a post on social media come up and I can see it's written by AI. Part of my brain just goes, wish. I kind of even if I think we're content, I'll sometimes read it and go, this is some really good content. But part of my brain's already switched off. And I do think that's going to be happening with patients in our communities as well. And if they get a little sniff of this seems a bit artificial, it can risk turning some people off. But the other side is that I think it's changing the expectation that people have. And it used to be, you get some people who are excellent communicators, some who are pretty good and some who weren't that great. And the weren't that great ones could, unless they were really bad, could maybe get by. They'd struggle a bit more. It wouldn't work as well. But what AI is doing now is raising the acceptable standards. If you can't communicate at least as well as an AI generated version can, then you're going to be seen as really bad, because nearly everyone's going to be doing that as a standard. So I think it's going to really raise the baseline. But then, so I suspect people are going to start looking for what are the human signals. I saw somebody a little while ago said they started deliberately keeping typos in their posts, because when someone sees there's a typo, they're like, "Oh, and you wrote this." Like,
yes, that's great.
Little signals like that can be really powerful to indicate to patients we're not just this AI generated kind of automated online. So I know that it's a personal relationship with the patient when they come to see us, but they're not just going, I'm going to click on, I'm going to book online, and I'm going to get an automated email and some automated this or that. Yeah, for chiropractic especially, that personal connection is huge. It's really, really valuable for patients. And I think with the AI side, there's certainly some risks if it's not used well. But I think it also is creating a lot of new opportunities for how we can give that to patients and how we can stand out our community as well, both as chiropractors compared to other professionals, but also, compared to other chiropractors in your area as well, if there's quite a few clinics.
Yeah, on the flip side, I listen to a podcast it's all about AI and technology and all that, and they actually were talking about the idea is our consulting services going to go away because of AI? And one guy, his argument is like no, because and his saying was like in the land of the blind, the one eye man is king. And so it kind of saying is like there's gonna be a lot of confusion out there. There's gonna be a lot of information out there. And so if you can bring just even, the human element to it, you can be the king there. Chiropractors, if your website traffic or Google Maps visibility has felt a little unpredictable lately, you're not imagining it. A lot is changing behind the scenes. AI is reshaping how search results show up. Competition in the map pack is getting tougher, and simply ranking well does not always translate into new patients. That's why Propel Marketing and Design is hosting a free chiropractic SEO workshop. You'll learn what's actually changing with Google Maps, how AI is impacting the way patients find and choose clinics, and what small, realistic updates you can make this year to stay visible and competitive. This is not a high level talk or a bunch of jargon. It's a practical step by step workshop built for busy clinic owners who want clear direction and next steps they can actually implement. Save your spot for free at propelyourcompany.com/MCM SCO workshop 2026. And we'll see you there. I think one of the things that is going to happen if it is historically, I think as doctors, we have been very distracted, right? We have a lot on our plate. We have a lot of things, whether it's we have this team meeting, I got to make this payroll, I got to get these notes done. And so sometimes a lot of chiropractors go in to their patient encounters pretty distracted. And so their level of communication and listening is distracted and not great. And so one of the things I keep on thinking and hoping for is that whether it's for me in practice or for me in life or for me in MCM, is if I can have AI simplify a lot of the things that aren't the human to human part, it will free me up potentially to be less distracted and have a lot more things being done to where I can go into that human to human encounter a lot less distracted and communicate even better. Do you have any thoughts on that as a potential?
Yeah, definitely. So this is one area that I've been using in my practice pretty regularly actually for the last year is AI note taking. Yeah, we use Heidi. I know there's other ones out there. I know Jaina. Theirs doesn't work in the UK yet, but they're bringing that as well. And I mean, I will say it's not perfect. You definitely have to check the notes. So for that reason, I don't use it with my regular treating. I've tried it. I find I've got my macros sorted. I know how to do my notes. I find it quicker and easier to do that than to get the AI generated ones and then read through and check them and then tweak them as well. But for my new patient encounters, it's great because I never write anything now. That I will basically just check with the patient style. Do you mind if I take some voice notes today? There you go. That's fine. And I can just sit and discuss with them, and I'll know that between what I'll happen to remember and what the AI scribe will lay down, we'll have a good record there as well. So I'm not having to spend this time writing things down. And whenever you're writing something, you're not present with the patient. And I would used to try and scribble it down quickly and work out what my weird, wacky hieroglyphics are trying to say later on. So I really like that, but I can just sit and have a conversation with them. And that is something that exactly like you say, it's made things, I'm more present, and that human interaction is much better than it would be if it was just me trying to make notes and things like that. So I really like it for that. I know some people who use it for all of their appointments. The current state of the tech is a bit too laborious. So I think you do have to pick and choose. I've certainly had experiences where I've thought, oh, AI can really help with this. I've spent several hours on it. I've got to the end and gone, I didn't really help that much, and I've wasted an afternoon playing around with it. I mean, being judicious with that helps as well. But definitely, it can free up things so we have more of that personal human time with patients. I think it's really valuable.
Yeah, and then even sometimes like on the patient experience that it could be utilized for, I just had a real life example. It's kind of like a a multi-part thing that it came to fruition with. But in our West Mastermind, Jared Bludorn, one of our members, he had brought up this really good idea, and I mentioned on podcast where, when you're talking to a patient, a lot of times we don't talk about tissue healing and what the standards are. And he used ankle sprain as an example of like, okay, sprained an ankle, grade 2 ankle sprain. It's, the literature says it's 6 to 8 weeks for tissue healing recovery. My goal in this treatment plan is to speed that up to 4 to 6 weeks, so shave some time off it. But you might get to a point early on where you're out of pain, but it doesn't mean the tissue's healed yet. That's why we got to keep on making sure we do the rehab and the treatment. Even when the pain is gone, we got to make sure that the function is restored. And so he's gone and understood the different tissue healing lengths for different injuries, whether it's cervical whiplash or it's disc issue in the low back or whatever, and uses that to communicate with the patient really well on the expectation of that treatment plan and why we need to see you for whatever, right? And it's more than just pain; it's also full recovery of the tissue. And that was like, I was like, wow, that's a great idea. I'm going to start doing that. So that I talked to one of our doctors here about it, and then he went into AI and looked up the top 10 conditions that chiropractors treat, what the typical literature says on tissue healing time, and he's equipped himself with that to go into the report of findings that have that conversation. And then if it's a condition that is not on there, he can just, or I can just go right to AI and look at it and have it handy as part, and it helps make my communication a lot easier. Whereas pre-AI, I may not have put in the effort and time to do all the, like, the searching for what those would be. And so this is an example where the patient sees the front stage of, wow, that doctor communicated that well to me and understood what the tissue healing length was, and it makes a lot of sense for me, and didn't necessarily see the backstage part of it, which was AI helping in that part. So I think that's a long-winded story of saying, I think if we use AI a lot in the backstage, it'll free us up to be really effective in communicating on the front stage.
Yeah, definitely. And I think there's even certain situations where it helps for the patient to know the AI is in the backstage. I mean, because they're looking a lot at AI, in the medical field, particularly around diagnosis. And the current research seems to basically suggest that patients like a diagnosis that are arrived at using AI, but checked and delivered by a human. Like they want to hear the doctor say, look, our fancy AI thinks you have this. I happen to agree.
Yeah.
I don't think in the MSK world it's going to go. I don't see AI being able to diagnose in the way that we do. It might be able to say, hey, based on these orthopedic tests, this range of motion, it can probably offer some pretty good differentials.
Yeah.
But I think there's situations where it would be fine to say AI was involved in this and patients would quite like that. But it's that delivered by a human. Like you say, the front stage needs to do that. Not just, I'll email you the AI generated diagnosis later.
Yeah, no, exactly. And that's where it's the human plus AI. And I'm excited for chiropractors in the sense that I don't think we have a lot to worry about with AI harming our practice. Now, you may have other thoughts on harming our existence on this planet, and that's a whole other story. But I think, podcast and a different set of experts. But I think chiropractors, obviously, having our hands is going to be huge. But then I also do think it's a potential opportunity for chiropractors to be even better at communicating. And I think people are going to be looking more for that connection. Again, whether it's the hands-on work we do or it's the ability to actually talk to a human being that is communicating well to them. I think it's going to be like a double whammy of great for us. And people are going to be searching that out because a lot of people are going to be living lives where they're talking to technology all the time. So I think it'll be ultimately good for us.
Yeah, definitely. I think it's a kind of force multiplier. I think the people who learn to use it a little bit are going to get the same bit out of it. The people who learn to use it pretty well are going to get even more. And I think it is going to, when it's used correctly, it's going to help differentiate both clinics in terms of efficiency. But you can have the most efficient clinic in the world. If patients don't feel like you care, they're not going to come back. So I think you are going to need both to really have the kind of practice, most of us would love to have, which everything runs smoothly. And we have like a great reputation in our area because people know Kevin, the guy to see, trust me, he really listens to me. He really took care of me.
Yeah. And I think, as we've dissected it out before on previous podcasts, when you're talking about the patient experience, There is obviously the clinical, and we've talked about that. There's the clinical, and you can subcategorize that out as to, okay, yeah, the treatment rendered and the results that is, but then also the doctor's communication in that clinical aspect. It goes a long way. I mean, it's just huge. The confidence the doctor has, the words they say, the questions they ask, the way they listen. I mean, it's just, sometimes it gets lumped into bedside manner, but it's more than just that. And then you have regular service, the service aspect of your business, and I think AI can help out with that. And then you got the hospitality. What are some of the unique aspects of your patient experience that's different than the usual? The difference between service and hospitality is, yeah, okay, the service is like, yeah, make sure my appointment is scheduled correctly and send me a reminder. Whereas hospitality might be a video you sent afterwards explaining what they had going on and a nice whatever, right? So, and that's what we're going to try to, our goal at you and I getting together in London is to really in one day put that together. You're going to tackle that doctor part of it, that doctor communication part, and I mentioned it last time we were on this is you did a webinar for us, our mastermind group, and just a lot of great feedback from that on ideas and thoughts on communicating that people don't necessarily think about. And I can't stress it enough because it's one of those weird things is like, it seems like it's subtle, the different ways that one should communicate, but that subtleness is just massively impacted. And so what are some of the things you've seen when doctors do make those changes, what it's done for their overall confidence, overall the patient confidence and experience from that is just some of the experience you've had over the years working with chiropractors on this.
Yeah, definitely. Well, I mean, I first got interested in this because of the difference it would make for patients. And when I got into coaching, I set up patient-centered training. It was all about, here's how to get better results with your patients. How to improve their outcomes. They're more likely to follow your advice, stick with the plan. They'll trust you. They'll feel more comfortable. That's all great for people getting the results they wanted. And then, I would start to add in that like, oh, and it turns out when you do a great job, well, that's really good for your reputation. So that's going to help your practice. That's going to help you to, get more reviews, get more organic referrals, build that reputation community. So, oh, that's pretty good. Not only are you helping people, but your diary is going to get busier. And the thing I love most about it now, though, is it's the impact on the doctor. It's the impact on the practitioner that when you get really good at this stuff, you can't really be a great communicator. I would argue you can't be genuinely patient-centered without having to have worked on yourself and done some personal growth as well. We like to separate, keep the personal at home when I'm a worker in work mode, and there's value to that. You can't come into the practice dumping about all the problems in your marriage or whatever.
It's true. Yeah.
But as I've grown as a person, I've become a better chiropractor, and as I'm growing as a chiropractor, I've become a better person as well. And it's that level of confidence, that level of, being able to accept patients where they're at and accept how things are and not feel like, oh, if they don't follow my advice, that means they don't trust me. It means they didn't think I was good enough. Maybe they think I'm not a real doctor, not take things personally. And also just, I heard this statistic a while ago that, it's when marriages split up, it's not because there weren't enough good times. Like you can have great times most of the time. When people split up, it's because the bad times are so awful. They're like, it's not worth the good times.
Yeah.
And I think when chiropractors think about, God, do I really want to do this? I'm like burning out, I'm not enjoying practice. I'm not having fun. It's not because they're not having enough good times with patients. It's because the awkward times, the tricky conversations, the patients not doing what you want, those become so draining. And really, if you work on this stuff and that not just the communication, but the service you provide, the experience your patients get, you can develop a level of not arrogant pride, but like a kind of, there's almost a level of humility and pride mixed in there. I know that what I'm providing is an excellent level of service. I know that I'm providing excellent care for patients. And I know that they're not really going to be able to get this from many other places because of that. If they choose to take me up on it, great. And if they choose not to, I go, well, look, I've got this amazing gift. If this person said that's not for me, I'm going, that's fine. I will go and give this gift to somebody else. And I mean, but now I can't remember the last awkward conversation or difficult patient I had.
Yeah.
I'm really, that's not like, oh, because I'm such a great communicator. That's because that experience, it brings out the best in the patients.
Mhm.
And yeah, they might disagree, but I enjoy practice more now than I ever have. I graduated 15 years ago. I have more fun today than at any point in the last 15 years. So yes, it's great that we provide those outcomes for patients, and it's great that can help grow our business, but that doesn't count if you don't enjoy what you do. And I've almost kind of changed the angle on some of the courses and things I do, where it's to say, this is how you can have more fun and more joy in practice of what you do. And it's great that gets to our patients as well. But for me, it's the practitioners who say, I'd fallen back in love with chiropractic again. I was losing the spark. Now I really love what I do, and I really enjoy, some people have been in this 20, 30 years, and you can see it's almost like there's a kind of younger energy. They're like excited to get back in and work with patients again. And to me, I think that's key, because if you're going through the motion, getting by, and your patients aren't going to get the best level of service, so they're not going to get the best level of care they could. I
Yeah, no,
love and answer your question.
no, I love it.
Let's take a short break from today's episode to tell you about the best decision I've made in my clinic in the last 10 years, and that has been adding shockwave therapy to our clinic. The outcomes have been really impressive. Certain conditions we were struggling with in the past, we're now seeing results with the shockwave therapy for that. And second of all, the ROI has been really good. When you make a big investment in something, you want to see a return, and we're seeing that return in clinical outcomes and in our investment, and that's been really nice to see. I chose Keenest Medical for 4 reasons. One is the technology is top notch. You have to have great technology. There's a lot out there that isn't quite up to snuff. The second thing is they have a really good clinical training. They have an exclusive partnership with Academy of Shockwave Excellence so that you can become clinically proficient in shockwave. You do need to get skilled at it. I think that's a big differentiator between practices that are getting great results and seeing the ROI is they have a great clinical aspect to that as well. So you want to get trained appropriately. Third is they have in-house service team for all of your technical support, which is key when you're investing in a machine like this. And then lastly, they have a very in-depth marketing and business support for you so that you can launch this into your practice effectively, that you can get that ROI on it, that you can get the clinical outcomes. And they also have really good financing options if you need that. So go to keenestmedical.com, KINAS medical.com, mention MCM podcast and receive a free shockwave in practice book with a purchase of a unit. So that's keenestmedical.com, KINAS medical.com, and mention MCM podcast.
A lot of times you get reinvigorated when you do work on yourself or your practice. I know I have over the years. That's why I love being in groups consistently to try to grow and push myself with it, which really helps. And then I think to your point is if you go all in and you really work on yourself on communicating with patients and really dive into that, and you make sure that your team is providing a high level of service, and you start to have fun around having good hospitality in your practice, not cheesy stuff, but like really, stuff that's remarkable. And you do that and you come to the table every day knowing that you're providing great clinical care, great doctor leadership to the patient, really good service, really good hospitality. Then if a patient outcome doesn't go the way you are, you gave it your all. If they're not, they're not on board with the treatment plan, okay, that's fine. That's, it's your confidence is high and you're not going to take it. It's not going to chip away at that, which I think a lot of people go to practice every day and they get dinged every day on their confidence because of things. And so if you get super proactive on building a great, let's call it product, which is the whole thing we've talked about, then it's hard for your confidence to get dinged like that. Some people are wired differently where they can just take it and all. I mean, no one's gonna
Yeah. I
impact your
will say
confidence.
I'm not one of those people. Like, negative feedback, can get under my skin a little bit. I've had to work on that a lot, but I'm not this naturally just totally people think I am. But look, it's taken a lot of work. That's not something that it's not naturally who I am. But as you grow that stuff, you do develop that confidence, and it's like a double-edged thing. It's like you said, on the one hand, if people don't want it, that's fine because I know I'm not. But on the other hand, if I've really worked and refined these things, there'll be a lot of patients who would have gone, I'm not sure. Not because of any one thing I did. It's not because the fact that when they filled out their e-tent form, I gave them a nice Parker pen, not a regular kind of cheap biro. It's not going to be because, my front desk called them the morning of the appointment to make sure they knew how to get. It's none of those one things, but you add them all up together. And patients come in and you go, I feel really taken care of. This isn't a transaction. This isn't just, oh, I'll pay you and I'll get the treatment and hopefully we both feel it was an okay deal. They feel cared for. That's something who's a practitioner I was mentoring for a while. He said to me recently, he kind of, I know you and I talked about the under-treating thing and the evidence-based one. And he said, it took me a while to realize that actually offering that extra 1 or 2 visits that I maybe wouldn't have, my patients feel really cared for when I do that. It's like they actually feel like, oh, good, I'm not being kind of like rushed out the door, off you go, and we're going to discharge you, and here's the stuff. And I think a lot of it is that, it's allowing patients to feel cared for. Not in a dependency way, but in a way where they feel like I got this attention and this level of focus from my practitioner and their team that I haven't got anywhere else.
Yeah. No, I love it. And that's where, we're going to dive in. I'm excited to be in London, going to be in the UK for close to 6 weeks, which will be nice, but we're going to do a little jaunt up to London and do this workshop, and you're going to do half of it. I'm going to do half of it. We're going to really get them leaving that weekend with a new detailed patient experience, and then obviously some things to work on to implement that. And so what are you most excited about for that event?
To be honest, I'm excited to getting a whole group of us together, like people who are really excited about this stuff, because it's like you say, it's not that it's all great doing it on your own, but I think having a group around you of people who are similarly motivated, because I know that you and I, we're going to turn up and teach because we put years and years of focus and training into this as well. But I know there's going to be conversations with some of the attendees there where somebody might go, oh yeah, we started doing this. Or someone else will go, hey, I just thought we could probably do this thing in our practice. And, we're all going to learn together as a community. It's not just going to be that sort of isolated teach-as-you mentality. And then getting a group of like-minded people who love this stuff and just have that growth mindset and want to get even better, like you say. That's what gets me fired up. I love those weekends of those kind of seminars and interactions when everyone's feeding off each other's energy and you can feel the whole room, everyone's getting excited for what they're going to do in the practice on Monday. So that to me, that's what I'm probably most excited about.
Cool. Yeah, it'll be great. They'll leave with a workbook and an action plan and hopefully a little bit more excitement around it as well. So, okay, that'll be June 20th in London. We've got a cool little venue that we're kind of closing on right now to get that done. I'll put in the show notes a link to register. You still have early bird until March 31st. So still early bird pricing until March 31st, and then it goes to regular pricing. And looking forward to being over there, Chris.
Yeah, me too. It's the week of fun.
And then if anybody wants to find out what you're doing, how can you steer them to your website?
Yeah, so my website is patientcentered.co.uk. We'll have the spelling in the show notes because we spell centered differently. I think the American spelling works, but I haven't checked that for a while. It's the best place but if you're on Facebook, I think there's only one Chris Chippendale in the chiropractic profession. So you can always find me there. Either that on my website.
Awesome, Chris. I appreciate it and looking forward to hanging out with you here in a few months.
Me too. It's going to be fun.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.